Well, what a delight to have back with us today Dr. Michael Berry, and of course he's Director of Pastoral Care at the Cancer Treatment Centers of America. We've had him on before, and he deals with a topic that I think is absolutely essential in so many ways, and he makes the connection between faith and health, and he does a wonderful job. Dr. Berry, what a delight to have you back with us today.
It's great to be back with you, Perry.
You're a busy man, and your writings and your work is just really terrific. And you have connected the dots in so many ways about the whole link between forgiveness and well-being. Before we get into some of the details, what brought you to this?
Well, the first duty of anyone in healthcare is to listen and to respond to your patients. And as I was caring for my cancer patients, the stories that I continue to hear were stories that we would consider to be forgiveness related. They were wounds that they'd been harboring for, in many cases, a number of years. What I found, Perry, was that as I was listening to my patients tell me about these stories, these experiences they'd had, I was very inept. I was unprepared after 8 years of formal theological education to help them find forgiveness. And what I've learned subsequent to that is that I have yet to find a seminary, medical school, or university that teaches its pastors, MDs, or psychotherapists how to help people do this thing. So in an effort to respond to my patients and get them the help that they were needing, we developed a forgiveness education program, which we call Release, the Healing Power of Forgiveness.
Well, you know, it's so interesting. The whole basis of our faith is based upon forgiveness.
You know, I couldn't agree more. I was doing an interview several weeks ago with a gentleman that's been in the ministry for 20 years or more, and I was explaining to him off air how important 1 Corinthians 1:18 was. The message of the cross is foolishness to those who are perishing, but to those who are being saved, it's the power of God. And I said, what's the message of the cross? I said, it's forgiveness. My body broken, my blood shed for the forgiveness of your sins. I said that the essence of Christianity is forgiveness. And this well-meaning pastor said, gosh, I really never thought of it that way. It's such a central part to our faith, but unfortunately, it's the white noise. We don't pay the attention to it like we should.
You know, two other places, Dr. Berry, it talks about, of course, Matthew 6 in the Lord's Prayer, forgive us of our trespasses as we forgive others of theirs. And then again in James chapter 5, it talks about forgiveness connected with healing as we go down, and it says pray for the prayer, have the prayer of faith by the elders and the anointing of oil. And then it gets down there and it talks about the forgiveness of our sins, one and asking forgiveness one to another. It seems like there is a link between forgiveness and healing, and I'm not suggesting that a lack of forgiveness is a cause of illness, but there is a link nonetheless.
Well, there is. And, an interesting Bible passage, since you were talking about Matthew 6, is Matthew 6:15, where Jesus goes on to say, after the prayer, goes on to say, for if you forgive those who trespass against you, your Father will forgive you. But if you do not, he won't. It almost seems as though Jesus is saying the only unforgivable sin is unforgiveness.
Whoa.
So something for you to consider while we're talking what the Bible teaches about forgiveness.
Now, are we dealing more than just holding a grudge?
Well, no, I mean, that's the essence of what it is. Unforgiveness we defined as the withholding of the negative emotions of anger and hatred toward the perpetrator of harm. We're keeping it inside. And what we've learned, Perry, is that there's a high cost to hatred. Keeping all of this anger and hatred inside has a deleterious effect upon a wide range of our bodily systems, including our immune system. So in working with cancer patients, as we do at Cancer Treatment Centers of America, clearly we're trying to help create the best environment for healing to take place. And while I'm on that, we're not saying that unforgiveness causes cancer, and we're not saying that forgiveness is going to cure it. What we're saying, Perry, is the very same thing that the National Institute of Health says, which is this: psychological stress facilitates the growth and the spread of cancer. How does it do that? It does it because when you're filled with all of this anxiety and anger and hatred, it's causing your immune system to flatline. It doesn't create cancer-fighting enzymes such as natural killer cells so that our body can't defend itself. So if you have cancer, based upon what we know, it's very important to treat a person's emotional wounds if what you want is the best chance of beating your cancer.
Is there some direct chemical reactions? I realize the immune systems are affected, but is there some like dopamine or something like that that's involved with all of this?
Sure. What happens is when we feel these feelings of anger and hatred, it creates stress hormones, adrenaline and cortisol.
Right.
And adrenaline and cortisol, Perry, basically, it's interesting to me how God's created us. What happens is adrenaline and cortisol help us kick into a survival mode. It's the fight or flight. And so in order to survive, we need to conserve our energy. It needs to be maximized toward survival. So what happens is your digestive system underfunctions in the presence of adrenaline and cortisol. Why is that? It's because even though we might just had breakfast or lunch, if we're in a survival mode, spending our energy digesting our lunch is less important than running away from whatever the threat may be. Reproduction, procreation is wonderful, but when there's a threat, survival is even more important than procreation. But also our immune system. Think about this. And again, this is how it seems God's created us, that in the presence of adrenaline and cortisol, our body senses something that's an even greater threat than the cancer. And so it shuts down the production of cancer-fighting enzymes, such as natural killer cells, which is your body's foot soldier in the fight against cancer. So even as life-threatening as cancer can be, and as ominous as tumor growth can be, our body senses that there's something that's even more important than that. So it shuts your immune system down, looking for whatever that perceived threat might be.
Wow. At what point, Dr. Berry, do you begin to go down this road when treating a cancer patient? Where in the treatment do you bring in the psychological and the emotional questioning?
Well, our patients come to us for a 3-day evaluation. During that 3 days, we have a chance to meet with them for 30 to 45 minutes. During that 30 or 45 minutes, we have the opportunity to share with them the wide range of ways we believe that we can help them cope effectively with their disease, and ways that we think that we can help enhance their ability to fight the disease. Forgiveness is one of them. And so we make them aware of the importance of that, and then we connect with them later on if they choose to treat with us. But another one is hope. And so we spend a good bit of time talking with our new patients about the importance of hope as well.
This is just absolutely fascinating. Is there any connection between unforgiveness and pain?
Well, I think that, sure. I mean, pain is unhappy, negative feelings that we have. So, I mean, I would say that that the feeling of unforgiveness is a painful experience. The problem is with it, Perry, is that what happens is over time we create a new baseline, a new emotional norm. So when someone says to you, after a while, how do you feel? You're going to say you feel fine, when in all actuality, it's been so long since you've been happy, you don't even know what it feels like anymore. So you become numb to the pain. You develop a new emotional baseline, as it were, so that a painful life or an unhappy life is just what you would consider to be your normal. So the number one trait of happy people, by the way, according to some research out of the University of Michigan, Chris Peterson there, is forgiveness. It's very hard to be happy if you're going around angry all the time.
Right. So when you begin to have this 30 to 45-minute time with a patient at the very beginning, and you're kind of probing around the unforgiveness area, you might bump into denial. No, I'm fine. Everything's fine in my life. I just have cancer. How do you kind of poke around through that to find out what's underneath that?
Well, denial's common, but an even more kind of difficult barrier to overcome is avoidance. Unforgiveness is a disease of avoidance because it requires you going back into your past and beginning to deal with some of these painful memories that haven't healed. And so we are all very good at avoiding pain. I'm sure you would agree. I mean, each of us in our own way are very good at avoiding pain. And so as a result, we don't deal with painful memories. What we do is we shove them into their past. We compartmentalize them, and that time will heal them, only to find out that doesn't happen at all. As I mentioned, we just develop a new emotional baseline, a new norm, and adjust to it. So it's avoiding it. Avoiding the pain is really what the problem is.
Have you experienced when you're talking to patients, have you come up with some kind of obvious symptoms of a lack of forgiveness when you begin to interrogate them?
Yeah, the most common side effects of unforgiveness is substance abuse. when we're in pain, again, we're trying to alleviate that pain, and we do it in a number of different ways. Eating. I mean, I cope with my pain through workaholism. Upon the conversation we had earlier, it's a fairly common way to cope. But sure. So we deal with our pain very often through substance abuse, drinking, eating, any number of different ways. And interesting that the second most common side effect is fatigue. I mean, we don't realize how much energy it takes to keep all this anger and hatred in until we let it go. And then suddenly our patients feel as though the weight of the world has come off their shoulder. In fact, our program is called Release, because people feel as though as they release this anger, they literally feel lighter. So it's a remarkable journey that we invite our patients to go on.
Where does hope come in? I mean, how do you provide hope? I mean, they're obviously there wanting to get cured and they're looking for hope, but how do you bring the total essence of hope into the conversation?
Well, Perry, one of the more common themes of our patients that we see with cancer are feelings of hopelessness. I mean, the diagnosis of cancer alone can trigger post-traumatic stress disorder in some patients. It's overwhelming. And very often what happens is, after the diagnosis, they get on the internet and they're looking up, whatever data they can find, and sometimes whatever they're finding statistic-wise is very alarming. So it's not unusual for patients that I see very early on in their treatment regimen to be feeling very hopeless. And again, we're trying to increase the levels of our patients' hopefulness without giving them false hope. False hope is when you promise something that you cannot provide. And that certainly isn't what we're doing. But we are trying to create an environment where hope can increase. Let me give you an example. I mentioned statistics earlier. Many of our patients come to us having heard statistics from either their primary healthcare provider or the internet or whatever it might be. But did you know this, that the gold standard for cancer statistics is created by an organization called Surveillance, Epidemiology, and End Results. SEER is the acronym. Platinum standard, gold standard. If you ask your oncologist to quote statistics, it'll be SEER data. I called up SEER one time and I said, can you explain to me how you create a cancer statistic? They said, sure. All we want to know are three things. The first is, what kind of cancer is it? What's the primary? What's the date of diagnosis and the date of death? Oh. Not, oh, by the way, did you get treated? What kind of treatment did you get? At what point did you enter into treatment? None of those variables matter. In other words, SEER data includes a lot of people who were never even treated for cancer, or who treated so late in the process that it didn't make any difference. So when you hear statistics, those statistics are weighted heavily toward the negative and may very well have nothing to do with you and your disease. But I just told you more about cancer statistics than most medical oncologists know themselves.
Wow. Dr. Berry, before we get too much further down the road here, you have two websites, reliefnow.org, and what can people get there?
They can find out everything about the forgiveness education program that we offer, which, by the way, are to churches for free. We don't charge them anything to come to their churches and teach it. There's no honoraria or anything. The other website, which I mentioned to you, is ourjourneyofhope.com. And that's a website that provides educational information to groups that have existing cancer ministries in their churches, or perhaps might want to start one. So we'll help them in that process.
Okay. There's some theological debate a little bit about self-forgiveness, and I don't know if we want to get into that one, but you do talk about self-acceptance and self-forgiveness. How do you address those?
Well, needless to say, at a cancer hospital, you are dealing with people who have, in many cases, a good bit of self-loathing. For example, someone comes to the hospital after smoking for 50 years, and now they have lung cancer, and they've ignored the Surgeon General's warnings for however many years, and so they have a lot of anger toward themselves. So needless to say, if what we're trying to do is to increase their immune system, what we want to try and do is bring down the levels of stress and anxiety and guilt and so forth around past behavior. And so that's where conversations about self-forgiveness comes in. However, the concept of self-forgiveness is not one that is readily agreed to in terms of what the terms mean. And we have found that self-forgiveness in many cases can be unhelpful. Let me give you an example. They did some research on some college students that went through a self-forgiveness program, and as a result of it, they lowered the levels of their drinking along with their levels of guilt, which I think we would agree would be a good thing. They're drinking less and they're not feeling guilty about their past as much. They did another study with a group of smokers, and what they did was they were able to get the smoking group to have less feelings of guilt, but it didn't change their smoking habits. They continued to smoke. And I would suggest that that's probably unethical. You know, I think God has given us guilt to be constructive. You know, it should keep us from doing things that we shouldn't do. So if you dismantle their feelings of guilt and it allows them to continue engaging in unhelpful behavior, I would say that's immoral and unethical. And I couldn't, in good conscience, encourage someone to engage in a process that might end up there. Hence, trying to come up with something that does stand a chance of being more helpful. We call that self-acceptance. Self-acceptance, Perry, is just simply saying, I'm a human being, I'm flawed. It's Romans 7. The very things that I want to do, I don't do. The very things that I do, I don't want to do. A wretched man that I am. Who's going to save me from this body of death? So Romans 7, I think, helps give us a very clear idea of what it means to be a human being, flawed with the wide range of emotions and feelings and so forth. But then once we accept ourselves as being human, fully capable of making mistakes as well as doing good things, then we ask them to accept 100% of responsibility for their behavior. They're not blaming anyone any longer. This is something that they have done, no one else. They're accepting themselves. They're accepting responsibility for what they've done. And then we ask them to take the last step, and that is to say, now how shall you live your life before God? What does your God expect of you in light of that? For example, using the smoking situation as an example, what that smoker may do, accepting responsibility for what they've done, accepting themselves as making poor decisions, but loved by God nevertheless, they may choose to engage in, teaching their children not to smoke, or to join, or to raise money for a local American Cancer Society. Do you see what I'm saying?
Yeah.
So I think that it's going to alleviate their feelings of guilt by helping them head off into a direction that is going to alleviate those symptoms of stress and anxiety and self-loathing by engaging in more altruistic behavior.
Your position in your ministry, Dr. Berry, is so interesting because of all the dynamics that people face when they've been diagnosed with cancer. I would assume at times it's an incredible opportunity to come alongside them and show them God's love, and perhaps even usher them into the family of God, so to speak, as part of your service. But what do you do when somebody all of a sudden gets angry that they got cancer? They just flat get mad. They may even be a believer. Why is this happening to me?
Well, that does happen. In fact, we have people who find out they have lung cancer who never smoked at all. So, there's even greater levels of anger. Well, we try and distinguish, Perry, between forgiveness and feelings of unforgiveness and anger. To start off with, anger, forgiveness-related things usually have a face. Hatred has a face. Anger, on the other hand, grows out of feelings of powerlessness. For example, you can be angry at a child but not hate them. And so there's a lot of times people have anger issues. They're powerless to change it. Every cancer patient has anger, Perry. They want to be at the hospital. They want to be home. No one loses control of their life quicker than a cancer patient. From the minute they're diagnosed, they got to go here, go there, do this, do that, eat this, drink that. Their life isn't their own. And so anger is just a part of the cancer experience that isn't going to go away until you get on top of the cancer. So we try and distinguish between feeling angry and feeling hatred, which is what gives rise to issues related to unforgiveness. It's hatred.
We're seeing the forgiveness topic show up all over the place. It seems like it's just all of a sudden it's had a rebirth of interest across Christendom. I'm seeing big ministries now begin to deal with forgiveness. Is that a symptom that maybe we just never carried this fully as part of our doctrines in the church? Why are we not forgiving? What's the problem here?
Well, I would suggest that it's spiritual warfare. I mean, maybe that's too simple of an answer, but if it's the core of our faith, then what's the one topic then that the devil wouldn't want us to talk about? Right? I mean, maybe I'm being very simplistic, but I'm not surprised that Christians don't know more about that topic. I mean, it's not even taught in seminaries, Perry.
You're right.
It's unbelievable. But I mean, the one core curriculum that we ought to have as a pastor or as a Christian is forgiveness, and many of us are very unfamiliar with that. So I'm glad to see that there's additional, folks that are talking about this in their ministries. It needs to be, for sure.
Is forgiveness and confession one and the same? Are they synonymous?
Well, I mean, I'm not Roman Catholic, if you're kind of alluding to...
No, but I just think, if you're sitting there and you do confess your unforgiveness, I mean, isn't that part of the healing process?
I would say it's part of the process. But what we would say, Perry, that keeps people trapped in pain is things that simply are not true. We believe that truth sets you free. And so while confession is a good place to get you motivated to start that journey, I don't think that that's all there is to the journey itself. Confessing that you're unforgiving and that now you need to begin might help you get over that disease of avoidance that I was telling you with, but it's not going to help you get to the discovery of whatever truth it is that you need to know that's going to set you free from your pain. A very common kind of tar pit that many Christians get stuck in is self-righteousness. As soon as someone hurts us, the first thing we do, Perry, is we point a finger at them and say, "You're bad." Well, what we're really saying is that we're good. So immediately we began this "I'm better than you" kind of discussion, in our internal dialogue, when in reality, the harder we look at them, the more we're going to realize they're flawed, quite obviously, because they hurt us. But the more we look at ourselves, the more we realize that we're imperfect as well. First base, Perry, in forgiveness is reached on your knees. There's a sense of humility that grows out of this whole discussion about forgiveness and being able to find it. It's a very humbling experience.
In your ministry, Dr. Berry, in dealing with patients and dealing with the whole act of forgiveness, have you carried it through with some patients all the way to reconciliation, maybe with some family members?
Well, in fact, the greatest story that I have to tell you is about a patient who did not survive her cancer. She came to us. She had gone through a horrific divorce. She hated her ex-husband with a perfect hatred. Keep in mind, during her 3-day evaluation, I'm sitting across the room from someone who is just filled with hatred toward her ex-husband. The problem with that is she got custody of her children, her 2 children. And needless to say, her kids heard about what a horrible person Daddy was. The problem is that they went to see their father every other weekend. And so kids were seeing a very different father than Mommy was describing. And what the result of that, Perry, was that it isolated the kids from their mother because they couldn't trust her. They were just seeing something different than her words were communicating. And so at the very time that she needed her family around her, they were kind of withdrawing from her. When she was finally able to help forgive her ex-husband, she suddenly drew those children back into her life again, and that led to a reconciliation of the entire family.
Wow.
They didn't remarry, but they reached the point where they could invite him back to birthday parties and family reunions and holiday parties and that kind of thing. So the forgiveness led to a reconciliation. And we talk about how the sins of the parents are visited upon the 3rd and 4th generation. We all understand that. But you know what, Perry? Acts of grace do too. Those children are going to know the amazing grace that their mother offered to their father, and that's going to make a tremendous difference to the 3rd and 4th generation as well.
Dr. Berry, I'm just fascinated with your work, and I want to say this from my heart to yours. There's a tone in your voice that is very soothing and very ministering, and I would have to think that the cancer treatment centers of America are blessed to have you and your research involved. You bring a dimension to people who are in trauma that is so terrific, and I just want to commend you for what you do.
Well, you're very kind, Perry. I'm just trying to pass on to others the grace that I've received myself, but thank you.
All right, so it's reliefnow.org or on ourjourneyofhope.com. Those are the two websites.
Correct.
All right, thank you. I look forward to having you back soon.
Thanks, Perry. God bless you.